Here's the metal ceramic 101. This is what it looked like. We covered it basically as metal underneath, and then now it's ready to put the porcelain. So regarding this metal ceramic, after we fabricated custom abutment, individual restorations, but the top of that, there's two units split together. Okay, and this one is the wax and casting, and we're going to cement this one too. But I'm talking about not only precision, I'm talking about the aesthetics, especially emergence profile, as thin as possible. Well, compared to round one. Okay, I have to double check here, and then inside the edge that follow the study model, which is from here. Okay, this is the guidance, which is patient has it. The most problem is the before pre-op or temporary, usually bulky, because temporary made from acrylic, and then probably on aesthetic. So we're trying to bring it in as little as possible to make nice slim, and it looks really good. So K9 to K9 buccal corridor. So we match it with after made putty. Okay, so that's the guideline. And I have to grind things more inside your embrasure, then create it natural as possible. That's the scenario number one to make this metal ceramic. Right now is we can do a pack, and then we apply the porcelain. So we're trying to hide it with the metal ceramic and create it lifelike restoration as much as possible with the shape and contour. And after that, we're going to cement it after gold anodizing. All right, just stay tuned. This is another 8 units metal ceramic, which is old school traditional way. This is after pack. This is what it looked like. We covered it basically as metal underneath, and then now it's ready to put the porcelain. Possibly we can add with us tissue, pink color. Right. Here's the metal ceramic 101. The main issue is the incisor and then embrasure. So what I use, the doctor said this is matching, and then I using the sand for embrasure in the proximal contact. So I add it. So my key is before I go to build up, I have to hide it. Hide where? Hide the edge area. Okay. And also embrasure areas for metal ceramic. I don't want to see any crack looking. I want that. Okay. So what I do here, this is it's very imperative. It's thin. But just hide it, that area which is a translucency area. But this case I don't have to make the exaggerate, but the light reflection wise, see that one is very imperative. So I'm going to add every area, and then also I can use it's very thin sand color for embrasure. So this is my first step to make the metal ceramic. Okay, then I can feel free to cut it when I do second build up. Okay, before I go to final build up. Okay, so I can make some nice contour already here. This is fluodentin. It has some fluorescency with opacity here. You can do this. Now you can do here with the sand, no problem. But before I go, just make sure the good thickness. That's what I'm trying to talking to. The frame design is very imperative before I go to the opaque. Then I know exactly what I do, and then I can see the same amount of the porcelain, and then not only the frame design and the final art construction. What I'm saying, that was then relay with the color, not only occlusion, and then protect the porcelain as well. Okay, so like this. I have a good room, the good frame design for marginal ridge, which is most likely marginal ridge has the problem, the cracking, especially metal ceramic. Same thing zirconia too. Okay, and then I can put here same as the sand color. I can make the first coat for that. So that was just my magic. So after final build up, it look like this. It's an overlay with the enamel. I'm trying to match the old bridge, but it's better. Slight contact tight here, so we're going to binding. Now it's almost done. And set up the height of contour and cervical areas. Make some indentation between all the tools. Alright, so now we can grinding gently and finalize it. is the 4 implants and 8 unique case, which is what I build up. They make the contours as good as possible. And these emergence profile and with the tissue level. Right, so trying to bring it in compared to the old bridge. I have to make more utility than this old one. Make a little bit feminine looking. And just a little divided. All about the symmetry in between the tools. So I have to polish and anodizing with a PFM metal ceramic bridge. We're going to cement soon. Same as usual cementation concept. It's the best setting. And then trying to make the good proportions of the tools compared to spy heating. And the doctor gave us previous information that we articulated with her now. And that one is you set the midline, the size and length, canine, vocal corridor, which is bone, and you can set up the final one. So a little bit correct line as well, emergence profile, colors matching. Previous one. And especially as we're trying to make this good facial contour, which is emergence profile. Doctor have to little trim it if they have to. So if tight, okay, then trying to minimize the panic. So the cement will be great. Awesome. After we cement, anyway, this is doctor sent to us to follow the shape and color. So we follow. I made a little bit better, improve the shape and contour for that. Well, its color is good. This is a finers. It's nice cementations. Usually what we do, we make the engaging abutment because whenever we finish it, I want snug fit in our chair side. But before we go to send it out, so cement, we remove the old hexed. So made a non-hex engagement, non-engagement. Temporary here, water, we improve from also. That's the final verification jig we perform. And then we just give them the little tissue, little tight, but because made a good emergence profile. That's the key. Alright, thanks for watching.